Hello, everyone. My name is Javad Parvizi. I'm a professor of orthopedic surgery at Acıbadem University in Istanbul. I have the incredible pleasure of talking to my brother and one of the greatest friends I have in orthopedics, Ernesto Guerra Farfan. He's been my right-hand man, right-hand friend, unbelievable mentor for the past 20 years. We have spent a lot of time together. I'm in daily communication with him. So he's a very special person to me, but I think he's a special person to orthopedics. He's contributed so much to the field. He's a brilliant thinker, always reading the literature, always attending meetings, probing questions. He's just brilliant. So I have the pleasure of talking to him today. He was part of the executive committee of the International Consensus Meeting 2025. And then on top of those duties, he also acted as a liaison and took on one of the questions. Ernesto, welcome to this podcast and thank you for being with us.
Thank you so much, Jay. Thank you so much for your kind words. Yes, you are my brother. I have been following you since more than 20 years, and I think that I have taken a big profit from you and learn how to think big, how to think big. That
Thank you.
what
And we were
you
both
know,
we were
yeah.
both babies when we met each other. So and now I have turned into an old man, but you still look the same. So
Uh,
you worked on the irrigation solution for the consensus. Tell us why you think that's an important subject and what did you guys find?
yeah, it is an important topic because I think that probably it is one of the intraoperative measures in which we can think that probably help us to prevent these deleterious, terrible, and catastrophic complications. Probably it's a simple solution, it's cheap, and if it is proven to be extremely useful, it can be used globally, including in in centers or health communities with lower incomes. Yeah.
So basically what you're saying is that the wound gets contaminated, it's never sterile, and there is some bioburden, and the irrigation solution serves the purpose of removing that bioburden below the immune threshold of the host so the patient doesn't get infected. That's basically what irrigation solutions do. Is that correct?
That's correct. After the incision, we are violating and opening the first protection barrier to avoid contamination of the field. And probably 30 minutes after the surgery, there is a high concentration of microorganisms in the field. And so one important preventive measure probably is lowering the bacterial load in the field. And the irrigation solution that we can use is a cheap and probably a useful way to prevent infection, periprocessus infections. Yeah.
Yeah, so by irrigation solution, people think about normal saline, and I think that works, but that works through dilution. But using an antiseptic irrigation solution, not only you have the mechanical method of diluting, but you also have a chemical reaction, and the antiseptic has a chemical reaction against the microbes. So was your work group more in favor of using an antiseptic solution, or were they thinking about normal saline?
We revised more than 1,300 papers, of which 24 had comparative studies and 5 were randomized controlled trial. And there is a substantial evidence to support the use of an irrigation solution with an antiseptic that can decrease the bacterial load in the field of around the prosthesis before wound closure, obviously. Yeah.
Perfect. And so what was your final recommendation?
Yeah, the recommendation of the of our group was that in total hip and knee arthroplasty and in spine surgery, there is a substantial evidence supporting the use of diluted povidone over saline as an irrigation solution to reduce infection rates. That's the recommendation of the group.
I got it. Yes. And I think the recommendation reads in total hip and knee arthroplasty and spine surgery, there's substantial evidence supporting the use of dilute povidone iodine over saline as an irrigation solution to reduce infection rate. You know,
Correct.
that particular recommendation is exactly in line with a lot of guidelines that I have seen, including CDC guidelines that I was part of. But also the recent SHIA, APEC, and IDSA also came out with the same exact recommendation. So your final word is that in orthopedic surgery, we should consider the use of povidone iodine irrigation solution as a measure to reduce bioburden and potentially help reduce infection. Is that fair?
Yeah, that's fair and absolutely true, according to the research that we made. But
You're the best.
there is some issues that regarding the usage of povidone iodine. That is probably the one issue is to be sterile or not. That is a big issue actually. Of the 20 comparative studies, only 8 reported if the povidone iodine was sterile or not, and the other ones didn't. So there is no any comparative study actually. There is one currently going on in hip surgery, prosthetic shoulder replacement, that is comparing surgery form, povidone iodine, sterile povidone iodine with experience that is acid citrate, and there is no actually any a study that compares povidone iodine sterile in a sterile way or the normal povidone iodine that we routinely use in the OR.
That's a great point. So I think that SHIA guidelines talks about a sterility also, and it says that surgeons should be aware of the fact that antiseptic solutions should certainly be sterile, because if they're left and they get contaminated, they can get contaminated because free iodine is the agent that works against the organisms, and it's very volatile. And if the solution gets contaminated, obviously you will have a problem. Fantastic for your amazing work. Any last minute words to our listeners, Ernesto?
Yes, currently there are several randomized control trials that are active. One of them is prevented that compare chlorhexidine diluted but betadine and saline and with or without vancomycin powder. It is going to be a big randomized control trial of 21,000 patients, and there are other ones that are comparing different groups. And we have important information during the probably 3 or 4 next years. Yeah.
Fantastic. You're the best. Thank you for giving us your
Okay.
time. And you're a very busy surgeon. And I look forward to seeing you in Madrid on 4th of December when you launch the Spanish translation. Thank you for your work on the Spanish
Thank you so
translation of
much.
the ICU.
And
You're the
thank
best, my
you.
brother. Take care.
Thank you.
Bye-bye. Thank
Bye-bye.
you.
Take care.
Perfect.